Hi, I'm Dr. Diana Londoño. I'm a urologist in Los Angeles and a certified life coach. Today, I want to talk to you about some ways where you can find different activities or systems or habits where you can take care of yourself in order to prevent chronic stress or the end stage manifestation, which is burnout. So let's get started. So one of the first things I think are really important to do in practice is to practice having boundaries. And boundaries means that you say no to things, because when you say no to something, you're actually saying yes to something else. And many times saying yes to something else is your sanity or your health or your self-care. In medicine, we tend to give all the time to others and we tend to neglect ourselves. And there could be many thoughts that prompt us to do this, whether it's, I should, I don't have time for myself, or it's hard for me to say no, or I'm concerned how people will perceive me if I say no. And I just want to offer that it's okay to say no. And that when you say no, it could also be that you say, no, thank you at this time, but maybe somebody else is better fit for, let's say, this role or some committee that they want you to be in. And again, you're just not saying, no, I'm not interested, but maybe somebody else could be a better fit. It's okay to say no at this time, my plate's too full, or no, at this time, I won't be able to commit all the time and energy I would like to do the best job. So practice saying no, and you can maybe do this at home with your kids, do a little exercise where you ask them for something and they have to say no every time and then switch, and you can do that. And you have to even beg and ask, and every time you have to say no. And notice how you feel inside every time you say no. It's kind of fun exercise, but practice it so that when the time comes, you're ready to say no and say yes to things that you really want to do. So that's first tip for self-care. Another great tip is check in with yourself. How are you feeling? This is something that we don't think about and that we don't really practice or are taught. Are you feeling hungry? Are you angry? Are you lonely? Are you tired? When you check in with basic needs that many times in healthcare are always overlooked or neglected, you realize you may need something. And if you continue to neglect that, it's going to really show up later and reactivity and answer maybe a way you don't want to react or answer to somebody. And it's important that you just check in, because sometimes, again, maybe it's been 8 hours since you last ate and you need to eat. You need to prioritize and say that no, so you can say yes to your lunchtime. Or maybe, again, you're tired and you really just have to say, I'm going to go to bed because I can't keep pushing and trying to do all this when I'm so tired and you're not even efficient. So check in with yourself, figure out maybe what are you needing, what are you lacking, what you need to do for yourself. Okay. A third tip is having awareness. What do I mean by that? It means, again, it's sort of checking with yourself, having awareness of what do you need, what's going on, or maybe even how are you feeling about something. Sometimes you may be disheartened or frustrated or tired or so excited. So when you start thinking like, what am I feeling, and having that awareness, you can even start thinking, okay, but like, why do I feel that? Start exploring the reasons, and that may just make you have a better control about how you want to react to that emotion and not just be reactive. So having awareness is really important. Of like, why are you acting a certain way? Why are you feeling a certain way? And it really comes back to a thought, like you're thinking, this is not fair. Therefore, you feel frustrated, and then therefore you lash out to a colleague, right? So instead of just reacting and lashing out, just say, well, is that really true? Is that really true? This is not fair. Or is there some other way I can think about this? And when you think about that, then it may release that emotional charge that you're holding on to something. So again, think about awareness and That may just help you throughout the day. Another great tip is breathing. And I know that sounds obvious, but I'm talking about conscious breathing. I'm talking about breathing with an intention and to really do this regularly throughout the day. If you're seeing lots of patients, it's sometimes a good practice to maybe do it like right after you leave the room or right before you enter a room. And there's many ways to sort of practice, and it doesn't have to take a long time. You can do 3 deep breaths, just literally deep breath in, out, and do that 3 times. And that's going to just immediately reset you and make you more calm. But you could do that longer. You could do it for 1 to 2 minutes when you really need a boost of centering, calming down. And, it's going to be something that's easy and free. So breathe consciously. And there's, again, many ways to do it. Easy as 3 deep breaths. Some of these are more like used in yoga types of breathing. Let's call that ujjayi, where you breathe in and out through your nose and you make a sound like the water of the ocean's running in, or you're fogging a mirror with your mouth closed. So it's kind of like a deep breath through the throat. You can do different intervals of breathing in, holding, and exhaling, like you do a 4 inhale, holding 7, and exhaling 8. And that's just a different way to breathe. And again, what it's really doing, if you want to know about it in a neural pathway or what's happening, is it is causing the parasympathetic nervous system to be activated. And when the parasympathetic is activated, the sympathetic is sort of stopped, and you will stop that cortisol release, which is seen in stress. So you're going to feel much better. So try it, easy, free, will really make a big difference in your day. Another thing you can do is that you can, write things down or even draw things. If you're having a situation or a feeling or thoughts about something, what you can do is you can write it down. You can say, I'm feeling this, and this happened, and I'm thinking this. And when you write things down, what happens is you become an observer of that situation. You're no longer holding that emotional charge and it's released because you're observing what happened, and it can just be very calming, and it may just help you to, again, release that emotional charge. Again, you could also do it by drawing. If you think, what's my biggest problem, you can draw it out, and then you can actually draw the solution to your biggest problem. And again, that puts things into perspective, and it just may be very helpful. A great other way for self-care and to help you stop the cortisol is to practice gratitude. What does that mean? It just means that you spend time in the day, or you can do it throughout the day. But a great way to do this is at night or when you wake up in your day, write down in a notebook, a little journal, 3 things that you're grateful for, 3 things that, every day you can find that you're grateful for. There's so much we can be grateful for that we don't even think about. And that starts changes in your brain, where your brain practices to look for the good, look for things that are going well. And it starts changes in your brain. And they also starts releasing hormones like dopamine and serotonin, which make you feel happier. So you can do this, again, so easy. It'll take a few minutes, and it really will impact how you feel. So try it out. Don't take my word for it. And you'll see the benefits. Something also important is moving. Yes, moving. I mean, stretching, exercising, whatever type of exercise you like, whether it's, running, biking, yoga, dancing. It doesn't have to be fancy and orchestrated. It can be just a little dance off with your kids. It can literally be, as soon as you get home, kind of like shake it out. So movement is really important. It just, again, releases all the good hormones in your brain. It releases all the stress. If you've ever seen maybe a dog, when they fight with another dog, when they're upset, they're, fighting, growling at each other. But when that fight is over, you'll see that the dog will shake itself and then just kind of move on with their day and pretend like nothing happened. They are releasing that negative energy. So you can do the same thing. You can dance, shake, move, and release the energy that is holding inside your body. So again, try it out, release that negative energy, start off with a clean slate. Sleep is another important one I want to talk about today. So underrated, right? So we are also taught in medicine that we don't need sleep, that we can just go through the day with 2 hours and get to the full day the next day. But that's really not the right way to do it. And we would never recommend that to a pilot, definitely not to our patients, like not to sleep and go on throughout their day. But somehow we have been fooled into thinking this is okay in medicine, and it's not. So we need at least 8 hours, but everybody's a little bit different. But it's really important that you sleep, because there are hormones that are released at night that are the hormones and the chemicals that regenerate and repair all the cellular damage that occurs. And a lot of these peak throughout the night, and usually between 10 p.m. and midnight. So if you're not sleeping at that time, you really are losing out on the benefit of this. So that's why you need to rest and repair and close your eyes and go to sleep, because you are repairing all the things that are occurring at the cellular level, all over your body. It's really important. And you'll know, obviously, that if you're not sleeping, you're going to be more reactive, have less of a, ability to have more compassion, be more patient. So it's really important, for your family, for patients, for others, sleep, check in with yourself. Something else that can be helpful would be imagery, something where you close your eyes and you really imagine or focus on something that, you can find peace, you can find relaxation, you can feel warmth when you think about something. And you can practice this and close your eyes and just start thinking of a place, maybe from childhood, or maybe something, a place that you went to vacation, that is really a place that you can hold good memories in. You want to close your eyes and really imagine this place, and you imagine everything, what the room looks like, the temperature, the sounds, everything. And you just really focus yourself in this place. And immediately, again, having these thoughts is going to stop the cortisol release. It's going to stop, all the stress, and all the good chemicals that you want released in your body will start releasing. And if you want to also, you can always kind of have a guide or somebody in, whether imagined or in your family, that you feel supportive and loving, come into this space that you imagined. And again, that's going to release so many good thoughts that will bring compassion and love. And again, you'll feel much different. And you can access this anytime. So think of something, have your imagery as a tool for you, and try it out and see how you feel. Another helpful thing to do is to have a mantra. Mantra just means, it's a vehicle of the mind. That's what it really means. And a good way to think of a good mantra that could be helpful for you is think of something very difficult in your life that you achieved. What were you, feeling or thinking when you achieved this? What were you feeling when you achieved this difficult, circumstance? Were you feeling determined? Were you feeling courageous? Think about what were you feeling? And then of those feelings, change the verb of that feeling to I am whatever it is. I am courageous. I am determined. I am persistent. And use that, or put in a sticky note, your computer, your phone, so that when you're having a challenging time, focus on that thought. This is who you are. I am courageous. I am determined. And that will help you, again, from a thought, start feeling differently and just be more energized and more hopeful, determined. So again, think of a mantra that is helpful for you that you can hold on to and you can repeat throughout the day. Practice self-compassion. What does self-compassion mean? Self-compassion means that you are thinking about the common humanity, you have awareness, there's kindness and non-judgment to yourself, but there's an action involved in it. It means that you realize that there's limitations as a human and that you are not perfect. But it doesn't just let you off the hook like, oh, well, I'm not perfect, so too bad I was rude to everybody today. No, you have the awareness. You realize you didn't act the way you wanted to, but then you have an action of what you're going to do for the future to act differently going forward. So it's important to have that awareness we talked about at the beginning, but then again, stop judging yourself, stop saying, well, I'm so stupid, all this negative self-talk. Listen to how you speak to yourself and really speak to yourself like you would speak to anybody else, because usually we are much kinder to others, but we're not very kind to ourselves. So the way you would talk to a child or your best friend, when you act a way that maybe you didn't want to, talk to yourself that way. Have self-love, compassion. And again, that's going to breed so many thoughts of love and peace inside yourself. And you're just going to feel, more hopeful, feel more love and not be so, reactive and start all that stress cycle, which again releases cortisol. Cortisol then causes all these changes in your body. As you know, it's fight or flight. So heart rate goes up, blood pressure goes up, eyes dilate. You're ready for that fight. But chronically, which is happening to most of us, it really starts affecting your health and your mental health also. So it's going to breed negativity. It's going to lead to anxiety, depression. So we want to move away from that and practice some of these things I talked about so that you can feel better, so that you can take control of your life, thrive. So those are some of my top go-to things that you can do for self-care. Again, thank you for watching. I hope that was useful. Again, my name is Dr. Diana Londoño, urologist. I'm a certified life coach, and I'm the founder of Physician Coach Support, which is a free and confidential platform for physicians where you can get peer support by physicians who are life coaches. So come check us out. And again, take care of yourself. You are the most important person. Thank you.